Good evening, and thank you for watching. My name is Luigi del Puerto. I'm the associate publisher and editor of the Arizona Capital Times. I am moderating tonight's debate. The Citizens Clean Elections Commission is the sponsor of this event. As the state's voter education agency, Clean Elections hosts debates so that voters have the opportunity to hear directly from the candidates, ask questions on the issues that matter most to them, and of course, vote informed. Candidates that have a contested general election have been invited to participate in the debate. Candidates that have opted into the Clean Elections Clean Funding Program are required to participate, while traditional candidates are invited and encouraged to attend. Please note, candidates from both the Senate and House are participating in the debate tonight. As the moderator, I will ensure that candidates have the opportunity to engage directly uh, with each other, but also with you, the voters, as we get your questions. The questions that we will be asking this evening are coming directly from you, the voters. Leading up to the debates, Clean Elections conducted outreach to voters across the state to solicit questions for the candidates. Um, Voters that are watching this debate live can submit a question at any time. You can see the number or the email or the text number on the screen, but I'm going to repeat it here real quickly. Text 928-362-1062. Again, text 928-362-1062 or phone 480-937-1297. Again, 480-937-1297. And you can see the email on your screen. If you're sending in questions, please specify if your question is for any of our specific candidates tonight. We screen the questions for clarity to eliminate duplication, speeches, or personal attacks on candidates. And the debate is scheduled for 1 hour tonight. We will try to get to all of your questions. To our candidates, you will have 1 minute for your opening and closing statements and 1 to 2 minutes for your response to voter questions. We encourage an open exchange of dialogue, of course, and if you feel the need to um, respond, just go ahead and jump in. I may limit the responses for time management purposes. And of course, we remind the candidates and the audience that this is a respectful and professional environment. Our goal tonight is to connect candidates and voters so our electorate may vote informed. Joining us tonight are JoAnna Mendoza, a Democrat who is running for the state Senate, and Dr. Felipe Perez, a Democrat who is running for the House of Representatives. The order in which the candidates will speak has been determined by alphabetical order by last name, starting with the Senate. And since we only have one candidate for each chamber joining us tonight, let's start with Ms. Mendoza. Ma'am, go ahead.
Thank you so much, Luigi, and thank you to the Clean Elections Commission for hosting tonight's debate. I'm honored to be here, and good evening, everyone. My name is JoAnna Mendoza, and I'm a candidate running for Arizona State Senate and Legislative District 11. I consider myself a small-town kid born and raised in our communities who answered the call to serve her country. I served for 20 years in 2 branches of service. I've been forward deployed to combat environments like Iraq and Afghanistan and have led men and women in a variety of positions and situations. After retiring, I made my way back home to Arizona to put down roots back in our very communities, and I'm raising my son here. And I continue a life of service by serving as a school board member in my small rural community. And I've also served as a congressional staffer working in our communities to address some of the most important issues impacting folks across Arizona. And I've stepped into this political fight to ensure that every Arizonan is represented at the state capitol. And again, my name is JoAnna Mendoza, and I'm running for the Arizona State Senate and Legislative District 11. Thank you so much.
Thank you. And now, Mr. Perez.
Thank you, Luigi, and thank you for Clean Elections for hosting this tonight and everybody watching today because it's important. My name is Dr. Felipe Perez. I'm running for state representative for the same reason I became a doctor. I want to help people live long and healthy lives. I'm also frustrated by the state representatives in LD11. We trusted them to protect our safety and our lives and to invest and manage our tax dollars and the economy. However, the incumbents prioritized short-term gains, deregulation for years, which removed the checks and balances of a strong and healthy economy. Our incumbents wrote checks on the backs of taxpayers and put people into more debt. The incumbents' policies and leadership failed us during one of the biggest challenges in decades, the pandemic. And now our economy has collapsed and taxpayers are stuck paying the bill. It's not going to be easy to undo what the incumbents have done. I have worked my way out of poverty. I focused on long-term goals of becoming a doctor, and I want voters to know that when I'm elected, I will think long-term with your tax dollars and prioritize your health, your lives, and your livelihoods. My priority is to bring my life experiences that got me out of poverty, my medical and professional experience to help Arizona recover from this pandemic faster so we can fully open the economy, get back your jobs, and work together towards a better and sustainable future. My name is Dr. Felipe Perez, and I humbly ask for your vote. Thank you.
Thank you both. One of the questions I ask candidates, especially if they're running in a district that's heavily favored for the Democratic Party or the Republican Party, is realistically what your chances are, you think, of succeeding in your respective races. And I guess I'm just going to ask you that question as for starters. LD11, of course, is a heavily Republican district. Last time I checked, there are about 14,000. The Republicans have a 14,000 vote advantage in the district. I'll start with Ms. Mendoza.
Thank you for that question, Luigi. I think it's been a question that has been often asked. You know, when we first stepped into this race and I announced that I was running for state senate, I was told that it was impossible to flip this district. I think what we have seen over the course of the last year, and especially in 2020, is that the failure of our elected leaders in this district has really come through, has really shined through. We are seeing our communities struggle. There's no advocacy for the needs of our communities, and especially during the pandemic. So I think that even if there is an advantage with the Republicans outnumbering Democrats and independents in this district, I think what we're going to see and what we have seen this year is that folks are engaged. They're paying attention, and they're really not looking at the D or the R behind the name. They are looking at folks who are truly invested in serving their communities and doing what is best for them. And they're looking to elect someone who will put people first. So, we have done a lot of work. This district is now considered flippable and competitive. And that is a true testament, not just to the work that our campaigns have done, both Felipe Perez's campaign and myself, but the dedication of volunteers and also the involvement and activity within that is happening within our district.
And the same question for Dr. Perez.
Thank you, Luigi. I grew up in rural Arizona in a very poor community. None of my family members had ever gone to college, and we struggled. Our school was under-resourced, and so I fell behind in school. When I first told people that I wanted to be a doctor, they were supportive, but with a feeling of, you kind of have to be doing really well in school. You have to have money, have a background of parents that can support you to do that. And I didn't take no for an answer. I think if somebody has it in their heart to accomplish something, they can do that. And one of the things that we've been doing in LD11, when I did start, I did my research before I filed to run for office, and I knew that it would be a hard race. And one of the things that we've done is we've been running a really hard campaign. We've been resonating with voters, regardless of their party. I've had Republicans tell me, hey, Felipe, I've always voted Republican, but I know you're a self-made man, and I'm going to vote for you. And the numbers are favoring us. If you look at a lot of the polling in this district, LD11 is going to flip. It will flip. And we can see that in the data. Thank you.
Dr. Perez, I forgot to ask you, what practice do you do? What specialty, if you do specialize?
So I specialize in family medicine. And I also founded and I direct a family medicine residency program where we're training doctors here in Tucson. So
I do wonder if, I think for all the candidates, COVID-19 has appended the way you operate. Most candidates have chosen to campaign virtually. And I think that's still the case today. I do wonder if you're starting to go out in person in knocking on doors. Dr. Perez?
I haven't, Luigi, and one of the reasons is because I am a frontline worker. I see patients at our clinic. So I'm in constant contact with folks that could have COVID-19 that might be asymptomatic. So one of the things, and my wife is a physician too. So one of the things we took it upon ourselves is to really make sure that we are social distancing with other folks, because we are just too high of a risk to spread it. So no, I have not knocked on doors, and I don't expect to knock on doors. I expect to reach people by having meetings like this, by calling folks at their home where it's safer.
And Ms. Mendoza?
Yeah, I mean, that's a really important question. I think that most campaigns have had to think outside of the box. You know, I take COVID very seriously. My mom is a frontline worker for the Department of Corrections here in Arizona, and she contracted COVID. It is very real. And she, you know, the 2 weeks that folks were talking about that you're out for COVID, that 2 weeks was 2 months. And even after repeatedly testing, she continued to test positive. And you know, she's been back to work for about a couple months now, but she's still seeing the aftermath of COVID. She's still seeing the after effects. So it is very real, and because of that, I take this very seriously. You know, our campaign has adjusted our strategy to be more virtual, digital. We are doing no contact lit drops, which we're dropping literature off in people's doors. But for the most part, we're doing phone banking, and we're using our social media strategies and digital strategies to reach voters, which I think most campaigns have had to do.
How is your mom doing right now?
You know, as I mentioned, she when she went back to work, she was very sluggish. She was not able, she had like this fog and not able to think well. Her hair was falling out in chunks, which is an after effect of COVID. I mean, I think that in the future, COVID may be a pre-existing condition, but she is doing a lot better. She's strong. So thank you for asking, Luigi.
I'm glad to know that she's feeling better and she's back to work. Let's talk about COVID-19. Earlier in the year, Governor Doug Ducey imposed, of course, restrictions on businesses that resulted in many cases, businesses halting their operations. Either they're shut down temporarily, and the state is starting to reopen right now. Just a couple of days ago, Governor Doug Ducey said he will not order businesses to reclose. He will not impose new restrictions, even when the infection threat from COVID-19 in any county returns to substantial. And the governor made that comment when State Health Director Dr. Kara Chris predicted that some counties will likely go back into substantial spread starting this week, because we're seeing, of course, starting to open, for example. I wonder if you agree with the governor's position, which is he's not going to reimpose the strident restrictions that the businesses were under for a couple months. Let's start with Dr. Perez.
Yeah, thank you for the question. You know, having a strong economy, having a job is important to everyone. It is absolutely critical so that you can put food on the table, you can put gas in the car, and pay your bills. At the beginning of this pandemic, we had an opportunity to really try to slow down this pandemic so that we wouldn't have to close as we did back then when the stay-at-home order came out. Pima County had put together some guidelines on how to open up safely. And one of the things that our incumbents did in LD11, all three, challenged it. And so Pima County didn't do it. I think it is important that we do open up the economy, we open up the jobs, we open up workplaces, but we have to do it safely. And it can be done. With the right messaging, we know more about COVID-19 now. Wearing a mask definitely helps to slow down the progression of this virus. And that is the key thing that we need to message people is we need to open up as much as we can, but we need to take precautions. There's some counties that have said they're going to get rid of the mask mandate. And what that's going to do is going to put individuals at risk, but it's also going to put our economy at risk. It's going to put people's jobs at risk. So we need to move forward with opening up the economy, but doing it safely.
So it looks to me like you are on the same page as the governor on this one. At this point, at least, he's not looking to reimpose the restrictions that resulted in businesses ceasing operations.
You know, it's interesting because a lot of folks ask this question. And, you know, and we have this illusion that it is up to us to make these decisions. And it's really up to what the virus does. So I think we need to base our decisions on evidence-based, look at the matrix. If we have a situation where we are reaching critical numbers again, that is a bad situation, not only for people's lives and livelihood, but for the economy. So that has to be balanced, reassessed frequently to make sure that we can keep people working and we can keep people safe.
The same question, Ms. Mendoza.
Yeah, I mean, I think what is important to capture is that, information is changing constantly. We have to follow science and data, and we have to listen to the professionals. I think that, while we want to place the blame on one person, I think that collectively there are several individuals to blame from the top down. Elected officials have a responsibility to take care of the people that they have been elected to serve. And so what does that look like, especially when it comes to COVID, especially when it comes to our economy and small businesses? It looks like ensuring that we're passing clear, concise guidance on safety precautions, ensuring that our small businesses have the PPE and the resources to be able to implement these safety procedures. I will tell you that here in Pinal County, the governor was responsible for issuing CARES Act funding to us. And a lot of smaller counties like Pinal County were not getting the funding that they needed. And this severely impacted small businesses. So, I mean, I understand that we have to try to find a way to come through this together. And I think most businesses already understand that implementing a mask mandate when customers come in for their employees, hand sanitizing, social distancing is the way to continue to try to reopen and stabilize our economy. But again, Luigi, that has to come from the top down. And the governor has a responsibility to ensure that especially our small businesses have the resources they need to be able to do that safely.
Let me ask you about schools and school guidelines with regards to opening. Earlier on, there was a debate regarding whether it should be the state imposing guidelines, or actually, they wouldn't be guidelines in that case. They would be mandates that then specify when and how schools can open. And the debate is over whether that should be a mandate or whether it should be guidelines, recommendations, and leaving those decisions at the school level. Let me ask Ms. Mendoza, what is your preference, ma'am?
So in terms, what I'm understanding the question is about how to reopen our schools, correct?
In terms of the timeline and the guidelines and how to reopen, should you leave that decision to the schools, the school boards, the local governments, or should that be coming from the state as a mandate?
Well, I think initially what I would have liked to have seen was that there would have been some clear, concise guidance coming from the top. Initially, when we were impacted by this pandemic in March, that's when we needed those clear, concise guidelines on what to do. I think now we're in a situation where the decision is on school board members and on local municipalities. I serve as a school board member in my small rural school district, and we've had to make these decisions, but we're following the guidelines, the science, the data that has been put forth by the Arizona Department of Health Services. We have a 30-page mitigation plan. The superintendent and educators are constantly communicating with parents. We're offering a hybrid model for parents who don't feel safe bringing their children back to school because they may have someone who has a pre-existing condition or may be vulnerable to COVID. So we have done the best that we can with the science and the data and the information available to us. There's not there's not a cookie cutter answer for every community. I think that if folks are starting to understand the importance of doing their part to keep themselves and their families and their communities safe, because they understand that that means that they can reopen the schools. So we've seen that happen here in Red Rock, where folks are practicing their social distancing and wearing masks. And we're seeing that because of that, everyone's doing their part, and now we're able to open up our schools. So yes, this decision is on us now, especially like, school board members like myself. But there's not a cookie cutter answer for how to do this, really. And communities are all going to be different.
Hindsight is like 2020, right? If we were to kind of go back to earlier this year when the pandemic was starting and the cases were spiking exponentially, your school board member, would you prefer that the state decide for your school what to do and how to do things, or would you prefer that you as the school board member retain that ability to decide?
I think that local elected officials are the closest to the people. They understand what is happening in their communities. I think that having a conversation and having dialogue with the various levels of government on how to do this would have been the best approach. This is why our elected officials in this district should have been communicating with school board members, should have been talking to the local city council members, and then relaying that information to the governors so that they can work on a plan on how to do it together. That's how governing should be done. It should
But
be
just to, but
collaborated
just,
effort.
I didn't mean to cut you off, but just to
No,
go
no, no.
back to the question, would you give up that authority to decide for your school, and have the state decide things for you?
I don't think it's about giving anything up. I just want the opportunity to provide input and insight into how we can make things better. So,
Thank
I
you.
mean, yeah.
Same question for Dr. Perez, sir.
Sure, thank you. Being a father of 3 young kids, 2 of them go to school, I understand the challenges that a lot of parents are going through. And it's not easy. It's hard trying to have a class setting, or you attending class with a lot of second graders on that class, on that video. It is hard to keep my son on track and then doing homework with them as well. I think in this situation, it's no different than having any other natural disaster. And that's what this is. We are in the middle of a serious pandemic. I think we need to set this up just like an emergency command center would set up in a natural disaster. We need folks that are the experts coming in, giving guidance. And this needs to come from the state. We need to get experts involved, epidemiologists involved, medical personnel that are really coming down and figuring out what is best for our communities and making sure that they're not creating a one-size-fits-all. It won't work for everybody. Some parents might need to work. And so it is important that we create hybrid models, that we create completely virtual opportunities, but then for folks that really need their kids to go to school and learn in person, that opportunity is there. So I think the guidance should come from the state as expert advice, and then it's up to the school boards to decide how they're going to meet those guidelines to make sure that our students are safe, that our teachers are safe, and that we're not increasing these numbers of the virus, because then it's going to shut down everything again.
And so just to be clear, if make sure that I'm understanding you, your preference is that the local school officials retain the ability and decide for the schools when to reopen, the timelines, including what kinds of deliveries of education they can offer to students and families. Am I hearing you right, sir?
What I'm saying is that our state government needs to come up with the guidelines and the models that experts have deemed as being the best choices. And then the local school boards decide how are they going to meet those guidelines on the ground, boots on the ground. So it's really a partnership between both the state working with experts, providing as much information as they can to our local school board so they can make the best decision they can for their students, their parents, and the teachers.
Earlier, there was I'm sorry, Ms. Mendoza, yeah, go ahead,
yeah,
ma'am.
I just wanted to add one thing to what Felipe said. I think that, yes, we need to have guidelines at the state level, but we also need to ensure that at the state level that they're providing the resources, because we can make the decisions here, but if we don't have the means to do it, the resources, it's not going to go anywhere. So I just wanted to add that to what Felipe said.
Excellent. I agree.
So earlier, a couple months ago, or maybe a couple weeks ago, and maybe quite frankly, this is still an ongoing discussion. There was a lot of talk about potentially going into special session, legislators coming back into special session to do several legislation aimed at helping businesses, for example, but also Arizonans affected by this pandemic. And more specifically on the business side of things, there was a proposal to pass a measure that would provide businesses with, they call it the business liability measure. So broadly speaking, it would raise the standard to sue business for coronavirus related claims from negligence to gross negligence. So the bar is higher. And as a result, lawsuits will have to show clear and convincing evidence that a business was grossly negligent. Many Republicans are saying that this would protect businesses from potentially frivolous lawsuits. I wonder if you support it. Let me ask Ms. Mendoza first.
So, this bill is a result of the failure of our government and the failure to address COVID and to have clear and concise guidelines as to what small businesses should do and provide them with those resources. This is why we're seeing this bill. If the government, if the state government here in Arizona would have initially come out with very specific guidelines for businesses to follow and then provide the resources to be able to do that, then we wouldn't see this COVID liability bill. So, this is a failure. This is an example of the failure of our government and their lack of response early on to address the COVID issues. I think that if, small businesses are doing everything that they can to try to keep their employees and their customers safe. And you see it all across Arizona because they understand how important it is to keep their businesses up and running. They're doing the best they can. The problem is that they don't have the guidance, the clear, concise guidance on how to do that, and they're lacking in the resources. And again, that's the failure of our government.
Just to go back to the question, if you were a member of the state legislature now, or if you were elected to the legislature and this bill is before you, would you vote yes or no?
If I was a member of the legislature, I would have advocated for clear, concise guidance on how small businesses can open up safely. Luigi.
Well, I think I'm going to press you on this one because you will face this issue if you are elected to the legislature next year. There's no doubt that both sides, Democrats and Republicans, want to do something about business liability. So if this bill is before you and the conceptual framework is that it provides businesses some level of protection from frivolous lawsuits, would you vote yes or no?
That's really difficult to answer at this time. Again, I would advocate for clear, concise guidance on how small businesses should open. Without that guidance, I can't answer yes or no because we're not seeing that right now for small businesses. So I think that we first need to advocate and we need to present that information for our small businesses to know how to do that. So
let me ask the question differently.
I think that's going to be my answer, Luigi. I'd really like to move on to another question.
I understand. But let me ask the question differently. Do you support, just generally speaking, providing some level of protections to businesses against frivolous lawsuits?
Well, again, I think that they need to have some clear, concise guidance. Defining frivolous lawsuits, what specifically are we talking about? I think there needs to be a definition for what that looks like. And without that information in front of me, I would advocate for clear, concise guidance for how small businesses can open up safely.
Thank you. Dr. Perez, the same question, sir. If you were a member of the legislature today, if you were elected to the legislature and this bill is in front of you, would you vote yes or no?
Yeah, thank you, Luigi. I think one of the things just in hindsight and one of the things that our government should have made very clear is, and been transparent, is about COVID-19. I think there was a lot of miscommunication. There was a lot of false information being passed around to people that made them feel like they were safe because our government was opening things back up. That opening back up should have been followed with clear guidelines. And I'll tell you, a lot of businesses, especially small businesses, wanted that guidelines because they wanted to open up their doors because they are the most vulnerable of this pandemic. They don't have usually the general funds to really sustain themselves during this pandemic. So it was important that they open up. So I think our government should have gave clear guidelines. And if those businesses follow those clear guidelines, they should be protected from frivolous lawsuits. Now, if there was negligence, that's a completely different thing. But that's why we needed clear guidelines from our state government coming through, saying if you follow these rules to keep your workers safe, to keep people safe, then we will take action to make sure that we protect you from frivolous lawsuits. Because the last thing we need is a lot of these frivolous lawsuits where it becomes very hard to really point fingers. So I would be supportive of protecting small businesses during this pandemic.
So, when the governor started reopening the state's economy, he laid out certain guidelines for the specific industries. For example, I remember the governor saying if you're a restaurant, you can only open up to 50%, and then you have to do these things. If you're, if you're a bar, for example, there are things that you must meet, and if you're able to meet them, then you can open. There are guidelines about social distancing. Um, what guidelines do you have in mind that would be different from what the governor laid out? When you say that the governor didn't, the state and the governor didn't provide clear guidelines to businesses, what exactly are you referring to? Can you cite an example? Let's start with Ms. Mendoza.
Yeah, I mean, I think that came later on, right, as being pressured by small businesses to provide some more guidance on that. So that did come later on, and it wasn't something that came right off the bat. Again, there's different industries. You know, you can't have one template. Maybe there's going to be some things like the social distancing and masks that are going to be applicable to all industries, right? But then there are specific industries that need very detailed guidelines on how to do that. I am obviously not the expert on this. I think that there are experts that the governor could have consulted to make sure that those industries were then implementing those guidelines. So one of the concerns or one of the gripes that we heard from small businesses was that, you know, they just kind of threw together this, hey, wear masks and social distance, but they had very specific questions that they were unable to get answers for. So I think that, you know, depending on the industry, there could have probably been more detail to those guidelines.
I guess the same question for Dr. Perez. You saw the governor laid out these requirements before businesses can start to reopen, for example. When you say the state didn't provide clear guidelines to businesses, what exactly are you referring to? Can you cite examples?
Absolutely. You know, it takes two people to do a business transaction. It takes the business owner and a customer. Even though maybe those guidelines were provided to businesses, I think a lot of us as the public were left in the dark as to really being transparent about what the guidelines are, how safe is it really. I had people calling me during the peak of the pandemic saying, hey, you know, they ended the stay-at-home order. So it's safe to go out now, right? We can go do all these things. I was like, no, we're still in the middle of the pandemic. So I think the communication, the education for the public about what was going on lacked severely during the pandemic. The other part of it too was Pima County took measures to really help with those guidelines and what did they mean? How do you interpret those guidelines? And what do you do if a business is really having a hard time interpreting those guidelines? So they had this whole plan, which was supported by the Pima Public Health Department. And our incumbents, the three LD11 incumbents, put a stop to it. So those are the things that we needed, where we had people that were giving resources to our businesses, guidance, revisiting it to make sure that the public was safe. Instead, it was more of a, here's a piece of paper of guidelines, good luck.
So I'm sorry, before I, go ahead, Ms. Mendoza.
So, you know, you mentioned about businesses open at 50% capacity. You know, for small businesses, that's a deal breaker, because if you have a small business who's already struggling to make ends meet, and then now you're asking them to open up at 50% capacity, that's utilities, that's the staff, they're not making that back in cost. So, you know, initially they should have had this list of things that they could have implemented. And I think that there could have been more input from a lot of those business leaders in the community to ensure that all of the industries were covered. And that was not done in the beginning. And then so you start to see this piecemeal of guidance start to kind of come down the pipeline, when initially that should have all been done up front so that businesses knew what they were going to be up against. They could provide the input specific to their industry, and they knew the requirements that they need to meet, whether it's training their employees on social distancing and safety precautions, or ensuring that they knew how to fill out these applications for PPE. That was another thing that we heard from small businesses, is that you had this stack of this paperwork for the application. They didn't know how to fill any of that stuff out. So I think there's just so much that could have been covered that could have really helped small businesses, that unfortunately, you know, there was a failure. There was a huge gap there.
So of course, if you're referring to the payment protection plan, is that what? Or I'm sorry, you're talking about
There was
the personal protective equipment. But just to kind of go back to the question, and before I leave it,
mhm.
um, can any one of you cite a specific guideline that you think the governor should have imposed that you think the governor did not impose?
I think one of the things that came too late was the mask mandate. Um, our incumbents really mocked that. They, one of my incumbents actually took a picture after the stay-at-home order showing that he was violating the stay-at-home order. He has repeatedly spread misinformation about COVID-19. These numbers aren't true. This is a conspiracy theory. People are lying about these numbers. So I think just having that clear picture ahead of time would have been critical to make sure that businesses stayed open.
So that particular mask mandate, a lot of that, I know the governor faced pressure, of course, to issue a statewide mandate. He didn't do that. He left it to the cities to issue mask mandates. But that's kind of a mandate for mandate or guidance for everybody to wear a mask when they're in public. But insofar as business guidelines, I do wonder, just to go back to the question, and if you don't have specific examples, that's
Okay,
fine. I just want.
I'll share this with you. So initially, when the pandemic happened in March, my mom, I shared with you that she's a frontline worker for the Arizona Department of Corrections. There was no guidance given to any of the state agencies. So if there's no guidance being given to the state agencies on how to keep their employees safe, imagine what the small business owner was getting. She initially asked about masks, and she asked, do we need to get some training on how we stay safe? And I remember having this conversation with her, Luigi. I was deathly afraid of what was going to happen if she got COVID. And what happened in May, she ended up getting COVID. Why? Because employers did not know, even for state agencies, did not know the guidelines and the safety precautions that they should be taking to keep their employees safe. This is an issue that is very, very near and dear to my heart. Because of that, my mom got COVID. And I shared with you earlier that it took her 2 months to recover. So more could have been done up front to ensure that employers understood the importance of implementing these safety precautions.
And I'll add to that we received a lot of mixed messages. I think saying there's a mask mandate, but then not wearing one yourself sends a lot of mixed messages to people. And is it safe? We have governors, we have state representatives that are not wearing a mask that say, I'm not going to wear a mask until they receive enough pressure because the numbers are so high. So I think leadership matters during a critical time like a serious pandemic. And this should have been implemented at the beginning. They are the mentors for our communities. Wear the mask. Be a good example. Don't be that bad actor that is out there without a mask, because the message it sends is that it's safe. And that hurt businesses more. If we could have controlled the numbers better, we wouldn't have had to shut down as much as we did.
So I want to pause here for just a second and then remind our viewers, if you want to send in your questions, please do so. I'm going to repeat again the number to text to. It's 928-362-1062. Again, it's 928-362-1062. Or you can also call in your question. The phone number is 480-937-1297, 480-937-1297. And of course, the email is also there on your screen. And please do send in your questions. We want to get to, or we'll try our best to get to all of them. So let me ask you about two questions here. One question regarding the ballot measures that are going to be on. The voters will have the chance to vote up or down this November. First one is recreational marijuana. I wonder if you support it. And let me start with Dr. Perez.
Sure, thank you. In Arizona, one of the nice things that we have in our state is when our state leaders fail us, normal citizens like you and I, everybody watching this video today, can initiate their own initiative. They can they can put whatever policy they want on the books to get it passed as a law. So looking at this Proposition 207 and 208, those are measures that show that our state leaders have not been listening to our constituents So they took it upon themselves to do that. In terms of recreational marijuana, you know, I definitely feel strongly that we need to decriminalize it. I think somebody having a small possession, it should be treated more as an addiction, not as a crime, so they can get the right kind of help. And so I do feel that we need to move in that direction. I also think it's a very complicated process, and I wish that our state representatives would have really addressed it before this came reality, because Arizona has anything that involves a medical decision where you need experts in Arizona goes through a sunrise process. So if somebody wants to introduce a new bill, experts weigh in on it before it actually gets to be voted on the House. And that's important, because if not, you can get a bill that just doesn't make sense, that is dangerous, that makes it through the House. So I really do wish this would have been something that our state representatives and state senators would have really pushed through to make sure it was safe. There are some really good things about 207. There's some other parts that I don't like, which is the one that the experts never got to really weigh in on it. But overall, I think we need to decriminalize marijuana. It's also a great tax revenue that can come in. I wish it didn't have to be this way. The voters will decide come November 3rd. They're going to be the ones deciding on this measure.
So you mentioned maybe a couple of provisions that make you hesitate. So, you know, this is going to be on the ballot this November. You'll have the opportunity to vote yes or no. Can you tell us which way you would go?
Absolutely. You know, I think that's a personal decision. My voting, what I vote on my ballot on November 3rd, actually, when I get my early ballot, is going to be my own personal voting. And I really feel strongly about that. I do think we need to decriminalize marijuana. I think we need to have experts weighing in on it. Would have been the best scenario. And again, this goes to we need leaders in our state government that are addressing the concerns of Arizonans. This should have been dealt with a long time ago.
Let me ask the question differently. If you were elected to the legislature, if you were a legislature now and this bill is in front of you, would you vote yes or no?
You know, I think that's hypothetical. I think if it would have gone through the sunrise process and it would have got to the House, it would have looked a whole lot different than it does right now. So I don't think that scenario would have happened. I don't think we would have had something similar like 207 that was being voted
What's
on.
your hesitation, if you can cite one?
That there has not been any expert input into it.
Okay. Ms. Mendoza, the same question, ma'am. Are you going to vote yes or no?
Well, you know, I think this is a very complicated issue, right? And just to kind of echo what Felipe said about this initiative, is that this is really a failure of our elected officials not addressing this sooner than now, right? We're seeing it on the ballot now because obviously Arizonans feel that this is a really important issue for them. I will tell you that I do support the decriminalization of marijuana. I do think that the additional revenue that will come from taxing marijuana will help our community colleges because we know that those have not been funded by the state legislature. And we're going to need community colleges so that people can get re-skilled to get back to work, right? If they've lost their jobs in a specific industry. It also provides revenue funding for infrastructure projects that we know have been severely underfunded in Arizona. Our roads are falling apart. They're unsafe. I mean, I live in rural Arizona and I drive a Jeep because I can't drive anything else other than that out here because if I do, my tire will pop off or any other horrible thing may happen. Our roads are unsafe for Arizonans. The other thing that I really think that is important to capture about this initiative is that there is a bullet point in there that talks about not marketing specifically to children. And of course, as a mom, that was important for me to see. But I think that regardless of whether or not Felipe and I support it is irrelevant because the voters are going to decide in November as to whether or not they support this.
You know, I don't want to necessarily interject my opinion, but your votes individually do matter.
They do.
You are voters. You
They
do
like to
get the
keep
chance.
those. They
Yeah,
do.
you do get the chance to vote this up or down. So I guess on that question, I don't think I heard a yes or no, but it sounded like you're a yes.
Well, I'm not. What I support is I support specific aspects of this, right? The decriminalization, the revenue that comes from it. I think to your point about our votes mattering, right? Is that some people do like to keep that to themselves, right? Again, this is a failure of our elected leadership not addressing this issue when they should have addressed it. So there's aspects of it that I do like. And I think that the voters are going to decide in November.
What is your hesitation? What aspect, if you can cite one, that kind of makes you pause?
That I don't speak for the entire state of Arizona and the voters.
No, but you personally, when you're looking at a proposal such as this, when you mention the fact that you're a parent, you mention, of course, that there's a provision there. It's not supposed to be marketed to children. That's one of the arguments, in fact, against it. Some people have said, you can say it's not going to be marketed to children, but you might, in fact, see children get a hold of this if it's get a hold of marijuana and use it if it's legalized. So I do wonder if you mentioned you have hesitations, and I wonder if you can cite one.
I didn't mention I had hesitations. I mentioned the aspects that I support of it. I think the same argument can be made about alcohol and cigarettes being marketed towards children or them having access to that as well. Again, Luigi, the voters are going to decide that they're going to decide how important it is to them as Arizonans.
Yeah, when you go if you are elected to the legislature, you're gonna hear some pesky questions from reporters like me asking you which way you would vote.
You're doing
and
a great job.
I tell you, there's no escaping these kinds of questions. Not just if you actually are a legislature, but if you're running as a candidate. But let's move on. Here's a question from from a viewer. If elected, would you take a bipartisan approach at the legislature? And what does bipartisan approach mean exactly to you? Let me start with Dr. Perez.
Sure. Thank you, Luigi. And an excellent question. I've been in medicine for a long time, and we all know that the best patient outcomes depend on the team. It is always important that everybody has an idea. This is what we should do. But I think really discussing it as a team is when we create really the best options for patients or anything else. We have 60 folks in the House. We have 30 folks in the Senate. I think a lot of them come in with their own ideas. When they pitch in their ideas, it's usually when it does get passed, it's changed a little bit, because I think everybody having input into the process really makes it the best, because you get really representation of everyone, and you have everybody's voice heard in that measure. So I will absolutely work with bipartisan. I will work with anybody, regardless of party, because that is the right thing to do for Arizona.
Ms. Mendoza, same question, ma'am.
I spent 20 years in service to our country in the military. And, I've worked with folks that, I'll be completely honest with you, I didn't always necessarily like personally. But because we had a mission, and sometimes that mission was critical, and certainly if you didn't do your part, you could risk the lives of others and the objective of the mission. So I have experience in working on teams where you have to accomplish a mission and you don't necessarily personally like each other, or maybe your ideals are a little different. But at the end of the day, everyone's input matters, and we make the best decision moving forward that will ensure that the mission is accomplished, and ensuring that we're doing that while balancing taking care of the people that we're supposed to take care of. So, bipartisanship at the state legislature is absolutely imperative to moving forward together through the pandemic. I think that to sit here and say that, we're not going to listen to folks across the aisle is unrealistic, and it's just not the right approach. I think by both Felipe and I being here today, we are showing a willingness to answer tough questions by yourself and answer tough questions by voters. And I think that is really, that demonstrates our commitment to serving Arizonans, regardless of what team you identify with, right?
Let me ask you a follow-up question on that one, just real quick. There's this idea in the legislature that if you have the majority, And when I say majority, you have 31 votes in the House and 16 votes in the Senate. It doesn't matter if you only have like maybe a handful of Republicans or a handful of Democrats. The fact is that you have a majority of the members supporting a particular measure. If you were elected to the legislature and you encounter this situation in which there is a majority of members, either Republicans or Democrats, um, or not either, both Democrats and Republicans in support of a bill, would you support then, in a way, defying let's say, the leadership? Let's say the Democrats hold on to leadership, defying the leadership by letting this proposal go and having the opportunity to vote on it and getting it out, let's say in the House or in the Senate. I hope I understand I'm making the question clear.
So I think what I understand, if there's a support for a bill that has bipartisan support, but the
leadership is against it. Let's say the Democratic leadership is against it. Would you actually advocate for it to be voted upon and to be passed?
I think that if the bill, and I want to be very clear about this, first and foremost, I will always do what is right for Arizonans, and I will always take into account what that looks like, right? I think that to say that you're going to vote along party lines or that you're going to try to be defiant to the leadership is not the right answer. I think that if this bill is good for Arizonans, this piece of legislation will help address some of the issues that we're experiencing, will help address those gaps, or it's just good for Arizonans.
Right. The problem with describing it as good for Arizonans is that's very, very arbitrary. What's good for you may not be good for another person, but it has the support of a majority of members, 31 members in the House. Would you support getting it out of the chamber if your leadership is against it?
Again, it depends on what bill that is. Again, just like you're saying, if the Democratic or the Democrats are in the majority and they don't support a bill, I mean, what is the content of the bill? And I think that that's very hypothetical question that really can't necessarily be answered. But I will tell you this: I will tell you that I will vote the way that that ensures that we're addressing the issues that are impacting Arizonans. And if it's good for Arizona and Arizonans, then that will have my support.
Dr. Perez, the same question, sir. Your leadership is against the bill, but it has the majority of members supporting. Would you advocate for its passage?
Absolutely. So I think, sometimes things aren't as straightforward as a yes or no. I think sometimes there is a spectrum of options and choices. I think one of the problems with a lot of our government this day is that we are very polarized, where people are just not willing to compromise and work together. So I think one of the things is really, if everybody agrees this is the best way forward, then we should move in that direction and not just be playing because I'm going to stick with my team and I'm not going to vote that way. No, if my party leader wants me to vote on something, then they have to convince me. And that's the way government should work. For everybody who's elected to office, it should be convince me because I represent my district and I want to do the thing that's right for my district. So to convince me, and I will vote for it.
So this actually has happened several times in the state legislature over some of the biggest pieces of legislation. You have 31 members in the House, just enough to pass it, and they have run into, the issue then becomes, would you support something that maybe you would vote against, but have the opportunity for that bill to be voted on the floor if it has a majority support. But let's move on. There's a question
from something to that, Luigi.
Just real quick, because we're running out of time. Yes.
I just want to add that that is what we are seeing in our government right now. This is why the public doesn't trust our government. This is why they're so frustrated with our system right now, is because you have stuff like that happening in our government.
You mean a bill getting a bipartisan support, or a bill not getting the opportunity to pass?
When you're talking about people voting along party lines because that is the pressure of what is coming from the top, you're seeing the type of partisanship.
Yeah. Thank you. Let me ask you about defunding the police. So this summer we've seen protests over the deaths of African Americans in the hands of the police, and we've seen protests as a result. Now, some of those protests are asking for defunding the police, and there's really two ideas about defunding the police, right? One is kind of maybe diverting some of the funding for the police into the community. But the other idea of defunding the police is just completely abolishing the police. That would be the effect if you completely took away police funding. Let me ask you, insofar as that idea of defunding the police, which would result in abolishing effectively the police, do you support it, yes or no? Dr. Perez.
Yeah, thank you for the question. I've been in medicine for a long time, and just going back to what I said earlier is when we function in teams, we have the best outcome. And one of the things that the police we need to do is reform. In medicine, we have psychiatrists, we have social workers, we have case managers that really work to address what the needs of the patient are as a team. And that's what our law enforcement needs. They're being asked to do too much. I had a colleague of mine who's a physician who somebody was banging on their door trying to get into her house and break into her house. She called 911. 2 hours later, the police shows up. 2 hours. 2 hours. How scary is that? Somebody's trying to break into your house. 2 hours later, the police are showing up. They're being asked to do too much. What we need to do is really make sure that our law enforcement has the resources they need. If it is a behavioral health case that really does not need law enforcement but needs a behavioral health specialist, then that's who we bring out to help. Some cases they should be calling physicians like me. Help us. This person is showing erratic behavior. What do we do? Instead of just treating it all the same.
Right. It sounds to me that you do not support abolishing the police, defunding the police in a way that would effectively abolish the police. Am I hearing?
I do not support that.
And same question, Ms. Mendoza.
I do not support defunding the police. Police officers take an oath to protect and serve their communities, much like military service members, much like the oath that I took many, many years. Sometimes when police officers are in community, some folks may feel a sense of security and safety. And for others, police officers brings fear. And again, to echo what Felipe said, police officers are being asked to do too much. They're being asked to address issues because of the lack of resources in our communities. Again, I do not support defunding the police. I support ensuring that they have the resources, but there also needs to be some accountability. So I support bipartisan efforts like the body cams, which the governor just announced that the state troopers would now be, they would be implementing phase 1 of the body cams. I support de-escalation training, investigations to the use of deadly force. So those are the things that I support.
It looks like we do have time for just one question, a really quick one. A couple of years ago, the state legislature passed a short-term rental bill, which effectively took away the authority of local governments to regulate short-term rentals. There are various proposals right now aiming to give back full authority, or at least some of that authority, back to the local governments. I wonder if you support these proposals. Ms. Mendoza, I'll start with you.
I am in favor of local government taking care of issues that are impacting their community. I do think that elected officials at the local level are the government that are closest to the people. They, go to the same grocery stores. They see each other when they're putting gas in their cars. So I trust that they have been elected for a reason, and that they're going to do the very best that they can to advocate for their communities. So I would be interested in hearing from local communities on how that specifically impacts them, and if there's anything that could be done at the state legislature to address those issues.
Dr. Perez, same question, sir.
Yeah, so absolutely. So, this kind of goes very similar to what we're doing with our schools. Is we have our state government working with experts, making sure that they're giving expert advice and that guidance to the local government. So I think that's what should happen, is there's guidance from the experts, and then local government decides how to implement those guidelines.
Thank you both. We are at an end. I want to give you the opportunity to do closing remarks. I think we started with Ms. Mendoza earlier, so let's start with you, Dr. Perez.
Sure, thank you. My name is Dr. Felipe Perez, and I humbly ask for your vote. My priority is going to be the economy. If you lost your job or you're working reduced hours because of the pandemic, I want to make sure that we are getting those jobs back. We also need pandemic relief. We got to put politics aside to make sure that our economy is coming back, our livelihoods are coming back, and safety is in place. I will use my medical training and evidence-based solutions to make sure that we can return back to normal as soon as we can. I care about healthcare, and I care about your healthcare. I want your vote to help me get elected so I can go and advocate for you and fix healthcare. And I also want to invest in the future. Education was very important to me. It brought me out of poverty, and I want to make sure that every kid in Arizona has resources, educational resources, to make sure that they can, if they're in poverty or no matter what background, that they can succeed in life. So my name is Dr. Felipe Perez, and I humbly ask for your vote. Thank you.
Thank you. And Ms. Mendoza.
You know, as someone who has a lifetime of service to our communities, to our country, I want to continue that service by addressing some of the most critical issues impacting our communities. You know, addressing funding for public education, ensuring that folks have access to affordable healthcare, especially during a pandemic, finding a way to reopen our schools, and ensuring that folks can get back to work to provide for their families. I believe that government should work for everyone, and I will work hard to make sure that government does work for everyone, that we have a responsive and responsible government that truly reflects our communities and answers those tough questions. I think that by both being present, by both Felipe and I being present here today, we are demonstrating a commitment to our communities, and I am invested in making sure that I will carry that same commitment to the state capitol to work hard for you. So I humbly ask for your vote on November 3rd. For more information, please feel free to visit my website at www.mendoza4arizona.com. Thank you, Luigi.
Ms. Mendoza, Dr. Perez, thank you for your time. This concludes our debate. To our candidates, again, we thank you so much for participating. To the voters, we thank you all who took the time to watch this debate and the other debates that are coming up, and to inform yourselves before the November 3rd election. The Citizens Clean Elections Commission is your source for nonpartisan voter information, and we encourage you to visit azcleanelections.gov. Again, that's azcleanelections.gov for all of your voting needs. That is it for now. Good night, and I guess I'll see you around.
Yeah.
Thank you. Take care and stay safe.
Bye-bye.